Okay, now I have to push the got it button. Okay, got it. So one of the sort of important details that we talked about earlier when we first started was how we're going to address one another. And we decided we're going to address one another as equals, and we'll all be on a first name basis. So that's how we're going to do it. And let's go from there. Okay. So does anyone in the community faculty group or the academic faculty want to talk about your particular interests so we can see if we can get some sort of synergy of attention and energy?
I guess I can go ahead and start. So I'm looking at more kind of helping bridge the gap for our nurse practitioners that graduate during that first year transition from graduating and being a student to an actual clinician, especially in rural areas. And what I've seen a lot in this area here is that new grads come in and they're just expected to go ahead and hit the floor kind of running with their own panels and stuff like that. They don't have a lot of mentorship or support. And so it does provide, or it does, they need more support. So I'm looking at trying to develop maybe like a program to where we can bridge that gap, since we don't get a lot of residency hours like physicians do. Usually our clinic hours are maybe 700 hours of clinical experience during our rotations, and that's about it. And then unless you have nurses that come from critical care backgrounds and stuff, there's a larger gap for those. So I've looked at different programs and trying to implement like maybe an echo type of education where, you know, once a week they come and have education regarding like primary care, or just providing more of like a residency type of program during that first year of transitioning from new grad to a clinician. So
that sort of transition year. I thought that was a pretty exciting concept. I don't know, Lisa, you're part of the academic side. What do you think about that kind of idea?
I love it. I mean, we encourage students where possible to self-advocate when they're starting in a new clinical site, to have a form of a residency where they don't have a huge panel right off the bat, but that's clinic and organizational specific. And correct me if I'm wrong, I could have sworn, I haven't seen this since I left primary care about 5 years ago, but I thought there was, and not for students, for clinicians, a primary care echo. I can't remember under which umbrella it was, but I remember presenting a couple of times and pulling in a student. So fascinated with the idea. And I know Van, one of my colleagues, is all over that.
So how glad I am that you mentioned that, because the clinic that you're talking about is the primary care AHEC tele-echo clinic, I think. Is that possible? Is it the clinic that Van Roper runs?
No, this was one specifically for primary care clinicians. So you would have already graduated, and it was open to NPs, pharmacists, physicians, et cetera, PAs, but it was specifically for folks who were on the other side. And they were in that space of, what do I do? What's going on? Did I make a mistake? But I haven't seen anything about it, like I said, in about 4 years. So I don't know what may have happened to that, because there's so many echoes.
Oh, sorry. Go ahead.
Oh, sorry, if I might interject. So one thing that we do have a general pediatric echo program where, because I'm one of the co-medical directors for that. And what we do is we have specific topics based on blocks. So we just finished a neurology block. We're going to go into sports medicine block. And this is just more so to build that sense of community with the rural providers in the state of New Mexico, specifically for pediatrics, just because there aren't that many peds providers and specialists, and then, you know, nurse practitioners and adult providers see a plethora of different patients. So Rebecca, I don't know if that could be something that could help. I can send you the information on that as well.
I think that would be great, actually.
Any other ideas to help out?
I'm just
gonna-
curious,
Yeah, go ahead.
because we're both nurse practitioners, I'm just curious where the New Mexico Nurse Practitioner Council is in this, because they have the regional groups, they have their annual larger conference, and then the smaller, more topic focused. So I'm just curious, and we don't have to answer that right now. I'm just curious because that is our state body, where they might be in funding or support or promotion, etc.
Right, they may be helpful too. The Echo Clinic that Van runs is really, in a way, is part of this group. And we have a lot of clinicians who join us. I think you ran one of them for Van. You ran one of the sessions for us. Yeah. And although many of the participants are students, we have several, there's so many, and particularly in nursing, people who come back who have a lot of clinical experience, but are getting more advanced degrees, either a master's or a doctorate, and they often work in rural communities. So that, so I will link everybody up with that clinic too.
Yeah, I feel like, there's a lot of support when you're a student, and then it's just gone when you're not.
Yeah.
And so that's kind of like the gap that I want to try to fill. And personally, like, I started out in hematology oncology, and I had a great mentor there. But when I transitioned over primary care, I still went through like, I paid for it on my own, like almost like a online residency program. So kind of have a couple of ideas in my head about that, but it was a year long. You met once a week, had all of these basically online courses. Some of them were live, some of them weren't, but it was just a lot of support. So a lot of it actually coincided with what I was seeing in clinic too. So you were able to apply it while you were doing this program. So yeah.
Neat. That's great. Thanks. Did anyone else from either side want to talk a little bit about interests that you might want to develop, or you might link up with one of your colleagues here?
Sure. Can you guys hear me okay? I switched my device. Okay. Awesome. So I have an interest in infectious diseases, specifically stewardship. And it's not really a completely fleshed out idea yet, but I would really like to work with some of the more rural providers and clinics in engaging them from the perspective of antimicrobial stewardship. As I shared with the group earlier, the majority of antibiotics prescribed worldwide are in the outpatient setting. And I think it would be nice to connect and try to understand any of their specific and unique concerns with antimicrobial use, patient education, vaccinations, which I think have some and to see where or if any work can be done to support them or provide any education. And I would learn. So that's kind of my thoughts.
So we'll just throw this out to the universe and see where it goes. But it seems that it's a great avenue for collaboration across the board, because it's so important these days. And to have someone who's such an expert on, Diari is already working with some of our rural communities in helping just present an understanding of antibiotic use, which is crucial. And things change and ideas change and political climate changes. And there's just a lot of need for more conversation about that. And Diari is an expert, and we should think about the best ways to really learn from you in our program. Tanya, did you want to say a few words about your interests?
Also? Yeah, I was just waiting for Diari to finish. So my interest is more along professional development, more along the clinical educator pathway, with a focus on medical student education and curriculum design for residents, which is what I focused on when I was a resident and a fellow. I'm just trying to get back into teaching and you know, better methods of bedside teaching and education. So that's where more my focus really is.
Is anyone else interested in looking at educator training, curriculum development? Or, I mean, no one has to say yes or no. It's something to think about. I think that that's a vital component of what this grant's about, is creating better educators across the board.
I think my topic might be related. This is Lisa. I'm using some internal College of Nursing funding to generate a series for faculty and staff. And really it's, they're going to be like the models, and then they can in turn use this in their classes. So it's kind of along those lines, because our college has 70+ faculty. We don't know each other. We don't necessarily know where we come from, background, values, et cetera. And I think that impacts us as a group, and it impacts our teaching. So I'm working with an outside consultant to develop some, we'll call them experiences for faculty and staff. And one of my other colleagues is doing some work more around specifically the Indigenous communities. So kind of, so I figure if we're, you know, the folks who are training the next generation of clinicians, we can't give away what we ain't got. So kind of some overlap with what Tanya's interested in.
Great. Any other ideas or comments about how you see your thinking development, about thinking and thoughts, how they develop for this year in terms of focuses? I don't want to push making decisions too early, but I think it's good to start thinking about what might feel good to do. And we'll be having the next 3 weeks or so is really the big focus is on just what are we doing, and as a team. So I hope we have some time in all of our next sessions just to have a little conversation if we can.
I forgot to mention that the sessions are focusing on cultural humility, emotional intelligence, and unconscious bias, because we don't have a dean or assistant dean or associate dean for DEI within our college. So we as faculty and staff are trying to figure out how can we, again, do this and use ourselves as models for the students and the communities that we serve.
There's nothing like learning together, right? Yeah, that's great. Any other thoughts?
Well, I guess adding to what Tanya had said in terms of like continuing just kind of like the education and teaching like the next generation. I know that the continuous professional learning program at UNM School of Medicine has this achievement in medical education, which is the AMAP, and they provide different like workshops and components that are required for providers to get for promotion. I don't know if it would be open for like community facilitators to kind of help broaden their way of teaching in the didactic sessions, and then the new environment of Zoom and having to be more interactive in that way.
Well, that's a great comment. You know, we talked this morning about getting involved with CPL, Continuous Professional Learning, and they're one of our partners. And I believe Gary Smith from that, who's retiring from that office, will be speaking to us either next week or the week after. So it's a great opportunity. Also, Tanya and Crystal and Lisa, I had forgotten about it actually until just now, that we can ask him specifically about what's available and what's available to community faculty. I think in this particular construct, I would hope that the community faculty scholars would be able to take those classes. But let's see what he says. And we can also explore what they offer. Do you know, Crystal, how long this program is, the required courses in educator excellence?
Yeah, so I mean, you can just pick 4 workshops from different like learning areas. I can copy and paste the link on the chat.
Okay, great. Well, that's a great start. Thanks. Thanks. And
So that actually, just to mirror what she was saying, I think that would be a perfect place to start. I
mhm,
think one of the biggest issues I've found being community, I've always been at large academic centers, so being involved in educational curriculum like grand rounds, journal clubs, things to, keep you immersed in like a teaching environment, those were opportunities were easy to find. We're kind of still somewhat remote from UNM itself.
mhm.
So even though there's a small core of us at Española that are all interested in teaching and we're doing the high experience with the medical students, we're still very remote from what's actually going on the, on the core academic level. And it would just be nice to get back involved with that with other faculty so that we're, maintaining a certain standard when we get these students coming to us.
Right. And so what we can do is help put together resources that are offered throughout UNM, including the many grand rounds, which are almost all online, I believe, where I think anyone can zoom in on those. And we can try to put that together, and as well as the primary care clinic that Lisa was mentioning, if we can find it. And also the tele-echo clinic is available every Friday from 12 to 1:30. It involves case presentations in the classic sense, but also a dedicated conversation about social determinants of health, cultural humility, and interprofessional practice and practice transformation. So I think we're just on time to welcome. Anyway, any other questions about one another or where we're moving forward or what we hope to do? Okay, so let's move forward, and it's a pleasure to introduce you, Stephen Murillo from Project ECHO.
Can you say that again? I'm sorry. I had to turn off my stuff.
I'm sorry. Well, it's your turn.
Okay.
You're up. You're our ECHO expert, and you're up. So you have the floor here for the next half hour until 4 o'clock.
All right. Perfect. Can you all see that? Okay.
Thanks.
Awesome. So my name is Stephen Murillo. I am a senior program manager at Project ECHO. I've been with ECHO for the past 7.5 years. I originally started on the medical side of Project ECHO, so I had a lot of experience supporting and managing a variety of health programs, everything from bone health to rheumatology to endocrinology, cardiology. I've done a bunch of the ologies here at Project ECHO, and I had the opportunity to participate and work on like 40 different programs on the health side. A few years ago, Dr. Aurora, the founder of Project ECHO, came to me and said, will you work with one of our partners from New Mexico Public Education Department and start an education K through 12 ECHO stream of business? And I was like, yeah, let's do it. I'm not the guy that would imagine I'd be working with educators, because I was always that kid that was like, Steven, just go to the hallway, man. And so I spent quite a bit of time since I was a little kid in the hallways all the way through high school. So it's funny that I work with teachers and educators around New Mexico now. But one of the programs that we do support is the Faculty ECHO program that last year was our first year going through it. It had 5 components, and it sounds like all of you will be participating in that. So what I'm going to do today is just kind of give you a background on ECHO and how it works. So if you guys can see that okay, I'm going to jump up to kind of our mission and vision. So at ECHO, our mission is to democratize implementation of best practices for healthcare and education folks, to especially to those that are underserved across the world. So the ECHO model has 4 principles. So those 4 principles of the ECHO model are amplification, so using technology to leverage scarce resources. Maybe you have an expertise in your field and there's not enough of you. The idea is that this model is to use technology to amplify and leverage those expertise, so more folks can be reached and strengthen that field's capacity. Another component is sharing best practices to reduce disparities. So in these sessions, we are sharing evidence-based practice. Another component is applying case-based learning opportunities to master complexity. This is when participants share a challenge that they are experiencing in implementation, and they receive mentorship from the subject matter experts as well as from their peers. So definitely an all teach, all learn idea there. And then finally, the last component is evaluation or data. We're evaluating and monitoring our programs often and consistently so that we are best serving our participants and adjusting where we need to adjust. So a lot of data that we collect really helps us pivot when we need to pivot. A good example of that was in COVID. So I was on the education side when that went down. And so adjusting, going from college and career counseling programs with educators, immediately transitioning into technology and supporting parents in how to use technology for students. Excuse me. During that time, they weren't aware of all the tech that kids are using nowadays in the classroom. So just being able to pivot is one of the things that we're really good at, especially with all the information that we're taking in. So where is Project Echo? So here you'll see a map of the United States. This is, and again, all the data I'm showing you today is from our 2023 report. Excuse me, y'all. And so this map does look a little different now, but they won't put out that report until the end of the year. So here in the US, we have partners, as you can see here. These are hubs. So these are folks that came, got the training from us, or they went to one of our super hubs who provides the trainings, and they come in and they take the ECHO model, do strategic planning, and launch their own programs. So you can see we're pretty much in almost every state in the US. Globally, you'll see that we're all over the world. We have partners and super hubs across the world. I've had the opportunity to help set up programs in Africa and South America. I've helped with programs in India. And so it's been really neat. I worked with partners in the UK and in France. So that's been super fun. And then I remember when they talked about potentially having a hub in Moscow, Russia, which I never thought that was going to happen, and it happened. I just happened to see it on a map one day, and so I was pretty excited about that because I was in that conversation originally, but then moved over to education. So that was fun to see. So what I want to show you all next is looking at the growth and the adoption of the ECHO model in our history. So as of 2023, like I mentioned before, you see the growth of the ECHO model, especially since COVID-19. That's where you see that big uptick. The areas of adoption in the ECHO model are various, and I'll show you a list pretty soon here, but it's been implemented in almost any area that you can imagine. Here's an example of just 73 that I just want to list. Otherwise, I'd have multiple slides for you to show you all the adoption areas. But since our very first HCB ECHO in New Mexico in 23, ECHO has been adopted for use around the world with 70 plus diseases and chronic health conditions just here in New Mexico. If I added all of them together, it'd be over 300. As I mentioned, I'm on the education team, so education K through 12 has been adopted. Early childhood's been adopted, and now moving into that secondary education space. We're looking to move into that space pretty soon here with a couple of programs in the next year or so. It's been used in law enforcement. It's used in sex trafficking. It's been used for a variety of different areas. So real quick, here's just ECHO by the numbers. So it has been 20 years since ECHO was created. And just to kind of give you an idea, so this is 2023, the numbers you're looking for 2023. But we saw in 2023 over 1 million ECHO session attendances, which puts us over 5 million since we started in 2003. We have 896 ECHO hubs that have been launched, with over 33 super hubs launched. A super hub is a hub that has been trained to train partners to launch programs like the ECHO Institute. Here we see that in 2023, we had 220 ECHO hubs that launched. plus an additional two super hubs last year. So we're definitely moving and growing. ECHO does have hubs in 63 countries with participants from 193 countries. This past in 2023, we had 58 peer review publications validating the ECHO model. And at this point, in total, we have 663 publications since we started. Here's just kind of a view for you all just to take a quick second just to kind of look on our publication by outcome level, so participation, satisfaction, declarative knowledge. So you can see that. Concentrate a little bit more on the education side here. We definitely have about 16 publications just measuring participant level effects in education alone. So we definitely like our data. We like to publish and we like to show people that it does work, that it's definitely worth the investment. So how does an ECHO program work? So what I'm going to do now is kind of go into not the logistics of it, but kind of what makes ECHO work. So an important part of an ECHO program is a hub team. The hub team can take on many different shapes and sizes in different ways. However, the team does consist of key areas. So for example, a leader or facilitator, this is the person who guides participants through the session. So they keep the conversation go, they're directing, they're kind of the traffic control of the ECHO session. And is a big part. Usually this person is going to be your champion or a solid subject matter expert who's just happy and excited about facilitating a program or a session. Coordinators and program managers, these are the folks that are responsible for the promotion, outreach, data entry, the logistics. So me as a senior PM, I'm definitely the logistics guy, getting everything organized and making sure that it runs smooth. We also have subject matter experts, so they can participate in many ways. They can provide presentations during an ECHO session. They can advise on the program design of that particular ECHO, and they can also be mentors to the participants during those sessions. The last one is our IT support. These are the folks, not everyone gets IT support, especially our partners, but here at the Institute, we have our own IT support. These are the folks, they jump onto our sessions and they're just there to help the hub team, help participants with any technical issues. So they can help troubleshoot. If people can't get on for some reason, they'll sit there and make phone calls on the back end and trying to get people looped in. So we're pretty good about making sure we share their information and can connect with IT should they need support. So that's kind of these are the folks that kind of pull the ECHO program together. They're the ones that are leading it. They're the ones that are coming up with the idea of it and things like that. So like I mentioned on the education space, it was a consultant with New Mexico PED that said, hey, we need to do some college career readiness ECHO programs. And Sanjeev said, yep, here's Steven, make it happen. So a team of two. So you can have a team of 4, you can have a team of 2, you can have a wide variety of folks that are supporting a program. So what does an ECHO session look like? So what you're looking at here, so this is an example of one session within a program. Participants meet frequently over a period of time, so it's definitely that idea of low dose, high frequency for learning. So participants meet over a period of time. Sometimes programs can meet weekly for 8 weeks. And that's a good example of a cohort-based ECHO. Other programs can meet every other week for a year. It just depends on the needs and feasibility, right? So each program is different. But for the most part, what you're seeing here is typically what you see during an ECHO session. You can change things around and move things around a little bit. But for the most part, this is what you would normally see. So the majority of the session is focused on the didactic or workshop portion, and then the case presentations. The didactic is expert-led, and this is when participants learn something new, best practices, those kinds of things. The case presentation, and this is the most popular part, is led by the participants, so those joining the session. And it's an opportunity for them to share implementation challenges, problems of practice, challenges they might be facing. And this allows them to collaboratively work with the group to solve a problem. And when I say the group, it's other participants, their peers, and also the hub team, so those subject matter experts. Through case presentations, we focus on the idea of the all teach, all learn. The specialists in the field are not the only ones with expertise. The participants being in the field know their field. They're developing their skills and they problem solve on a daily basis. What the experts do is they have developed strengths that can create a space where they can share the knowledge with the folks participating. This is why the questions and recommendations always come from our participants first before our subject matter experts. So a good example of this is if somebody's presenting a challenge on using an education example here, if somebody is dealing with like a funding issue for their school and how do they get businesses in the area to come and willingly volunteer to do a job fair, right? They could share with each other what they've done, but then an expert on the hub team can either validate that or also add additional ideas in what they've seen successful. So that's pretty much a quick overview of what a session typically looks like. Fundamentally, the ECHO model is a tool to help upskill frontline workers. It's done by providing ongoing mentorship and guided practice, discussions between experts and educators driven by real needs and actual cases of those that are on the front lines. It creates a, how do I want to say this? It's fostering a social network for the participants. And it's really an efficient and effective way to support the implementation of best practices that these frontline workers are learning about from the subject matter experts. And it also creates a safe place for dialoguing, learning, and development. Oftentimes, a lot of people will be afraid to present a case because they're afraid of feeling dumb or they should know that answer. And the idea is by creating the safe space, they can talk things out and kind of lower that barrier down so that they can grow and gain that professional development. So with that, that's pretty much the gist of my presentation. I know for the programs that we're starting in for Faculty ECHO, the first component is mentoring development, which it kicks off August 7th. And that first session is actually going to be around defining mentoring from the beginning. And then the next session, the following week, will be about rewards and challenges of mentoring. So if you would like more of that curriculum or more of those topics to be ahead of the curve, definitely I see Wendy and Sam here, so feel free to reach out to them and see if they had any more information to share with you. I could definitely share it with you, but I think Wendy and Sam are probably your best bets because they'll be more directly related. With that, any questions that folks might have? I think I took 18 minutes. I'm not sure. I think we have time for Q&A.
I'm just curious because there's so many. That list you showed us had like 60 plus different kinds of echoes. What's the process by which somebody introduces a potential new kind of echo, whatever that topic might be, whatever that group might be? I'm just curious how that process works.
So typically, so it depends where they're starting from. So if they're internal kind of TONN, they kind of just go talk to Sanjeev, and Sanjeev will have them go to our partner launch training and they do their contract work. And just depending on the subject area, depends what kind of level of support we can offer here at ECHO. So we primarily focus here on New Mexico. We do have a few folks that do support some of the national programs that we do help operate and run. But for the most part, the other side of it is we call them partners. They're folks that they have an idea, they're passionate about something, and they'll reach out to us. We'll put them through the training. We'll help them with strategic planning. We'll give them all the information they could ever want. We'll give them so much information that they'll forget what they just learned. That's how much information we give folks. We utilize Box. It's called Pearl, Project Echo Resource Library, and they get access to agendas, strategic planning documents, other presentations that folks have done to help them build their own echoes. So it's really driven at the end of the day by their passion and desire to start an echo. I know we do have an educator hub up in Wyoming, and their original intent was to support educators with working in special needs area, so special education. So they were really the first ones to start education echoes, but it was definitely a little bit more to the health side. As far as like K-12 and student and teacher interactions, that's where we were kind of the first ones into it. I hope that answered your question, Lisa.
Yes, thank you.
How does someone, if someone wants to participate in an echo session or in an echo series, what's the fastest way to sign up in terms of getting, getting to be part of the mailing list? How do we do that?
So we try to be strategic about who we're sending out our information to. So for example, I'm working on a college and career counseling echo. And so we're definitely targeting folks that are advisors. We're targeting coaches, for example. So like coaches, oftentimes in a very rural area, they're the ones that are doing the college advisement for their students. You can imagine a school of 100 students. They probably don't have a counselor or even an advisor. So it's usually a coach or somebody that's taking that up. So we try to target those audiences specifically, whether it's New Mexico PED or us driving out there. We try to distribute all of our flyers with simple QR codes where people could just register online and get signed up. Often it's very rare that I see somebody reaching out to us like, oh, I signed up for this, but this isn't what I wanted. They're so deprived of the best practices that when something comes up that's related to them, they can sign up. We make it so easy. We provide emails, QR codes, bit.ly links, social media. We use Facebook. We were on Twitter for a minute, or X for a minute, but then we had to get off of it because of our communication. It seems like, oh, we shouldn't use that. So that was cool. But pretty much whenever somebody gets a flyer, and even if they're not interested in that particular program, if they send us an email, we'll connect them to the right program. So I've definitely directed many of people, like, I've heard of Project Echo, I'm a provider. I'm not actually interested in K-12 education. I'm interested in, say, endocrinology, for example, and we'll connect them and get them onto those listservs and help them out. Did that answer your question, Helene?
Yeah, well, what I was just wondering, say, if some of our scholars, I'm just trying to put myself in their shoes, they're not familiar with our system, our community faculty scholars, as much as academic faculty scholars. And if they've already expressed an interest today in being able to learn more. Tanya Bell spoke about the missing and sort of academic component to her life because she's not in an academic institution right now. So Tanya, who does emergency medicine and critical care medicine, are there echoes that would be of particular interest to her that she could sign up on too?
Absolutely. So you could definitely send me an email and I'll just connect you with the right people. But if I get you, let me pull up the email address and I'll put it in the chat to our team that specifically does that so that it's just quicker. So I'm not playing the middleman.
Right. Thanks. That's great.
So yeah. Oh, I wasn't sure. And it was super simple, but it's been a while since I've had to do this, but it's echo@salud.unm.edu. If you just send any inquiries there, they'll direct you to the right folks. And I can also do it too. So
Thank you. I'll copy down that email and I'll touch base with you probably next week to figure out what the next step should be.
Yeah, feel free. And let them know you talked to me too. And they'll probably just send it right over to me. So we could do that as well.
Are there any other questions for Stephen?
Well, in terms of kind of, because you had mentioned something really interesting that like our community members aren't aware of how to get involved with the ECHO sessions to either learn a little bit more, get continuing education, or even bring up the topics and cases. Had there been discussion with like DOH and the like communicating through the HAN, like the Health Access Network?
I'm sure there is, because I know DOH is definitely involved with ECHO, and they attend quite a few of our programs. Actually, when I was on the health side, I remember seeing them all the time. I'm not sure where that conversation is. Speaking from my experience in the education side, so like working with like New Mexico Public Ed Department, you can imagine the turnover rate over there it's pretty much new administration, somebody else that we have to find out and figure out who that person is to work with. So if it's anything like what I have to deal with the New Mexico PED folks, just that constant turnover and trying to get that word out hasn't been easy on our end. So we really rely on word of mouth. We rely on making sure our resources are easily available. So one of the things that we do, so if any of you all are joining the faculty ECHO, you'll actually see our Padlet page that we created. And we use this in all of our education programs, but it's an open link where folks can go in there. They can review videos that they can view recordings of sessions. They can review any of the resources that were provided by the hub team or participants, and any other kind of things that are provided. And we just we make sure that every session we put that link into the chat in Zoom. We make sure that we make it as easily as available, so that, say, Crystal, you join and you're like, actually, I think my colleague would benefit from this. You could just send them that link and they can access it right away. So we try to make sure that our resources are super easy and super accessible. So it's not super easy, but I think we've been able to overcome some of those barriers for sure.
I have another question, if anyone else has a question, go ahead in front of me. But my question had to do with the kind of outcome work you do, how you put together data and publish your results. In case any of our scholars are interested in doing that kind of research, I mean, the academic and community scholars, in case any of them are interested in doing that kind of research, is there a way for them to, who would they talk to if they were interested in joining a team, say, doing outcomes for ECHO clinics?
I think probably the best way to go about doing that is to connect with our Ready team. They're our data team, and they help us create and manage our evaluations, and they do all the IRB stuff for me. So I really appreciate them. But I know in the past we've had a couple people reach out because they were interested in either gaining that skill or being contributors to that. I would have to refer you to them though, because of all the things that they're doing for 40 plus at least 60 plus programs at this point now because of the education stuff. But yeah, if you email that echo@salud email and just ask for the Ready team, REDI, they might be the best people to talk to. I didn't show the slide because it was a little bit more geared towards education, but let me just show it real quick. I know I'm eating time here. Can you see that okay? Yeah. This is our impact model that we came up with, and we're able to back this up. So basically, the educator experience. So educators in our programs experience evidence-based practices, accessing the latest research and methodologies. They collaborate with their peers, and it quickly moves on right into our participating educators. They get to implement these learned strategies, adapting to their diverse classrooms and needs. And then as you can see, moving on to the students' impact. So we don't work directly with the students, right? It's all the educators and participants that we work with. It's never the students. On the health side, it's never the patients. So here you can see that for these students, they get to experience best practice instruction. from more effective teachers, resulting in enhanced engagement and higher quality of education. And it increases their achievement and retention of the materials that they're being taught in their schools. So this is just a quick example of something that we were able to come up with and back up in the education space with our student impact model. So I don't know if that was useful or if I just totally went down the wrong path there, Helene, but
no, I think it's great. And
I
most
would just share that
importantly,
with you quickly.
I think we all feel that if we have questions about ECHO, whether in terms of joining a clinic or doing research, then we know who to call. Like, we're going to
Yeah.
call you. So I'd say,
Absolutely.
yes, thank you. And this has been a very helpful conversation. If any of us have, if any of us here in the room have other questions for you, Stephen, I appreciate your willingness to answer. And I think many, there are just lots of ideas probably mulling around in people's heads about ways to connect with ECHO, because it's an established model that might be a really great way to not only join the clinics, but to think about research too, or outcome studies, however you want to frame it. So I want to thank you very much. And we really appreciate you joining us. And next on our agenda, and the timing was perfect there, Stephen, way to go. Excellent. And next on our agenda, we have Christian Mateo Garcia, who's going to be speaking with us about academic writing. And thanks for joining us. Do you want to tell us a little bit about yourself?
Yes, ma'am, definitely. And then also Dr. JP Sanchez is, I think he's going to do most of the talking, and then I'll kind of fill in. Great.
Well, thank you. I had your name, but I didn't have JP Sanchez's name. So welcome to both of you. We are in this lovely meeting room here. We have our community faculty and academic faculty scholars who are part of the DOE Center of Excellence. DOE. I'm full of acronyms. We're part of the Office for DEI Center of Excellence in Diversity, in Workforce Diversity grant, and we have academic scholars and community faculty scholars who are interested in learning about some of the resources that we can offer them, including about medical writing, academic writing.
Hi, everyone. So it's good seeing you, Helene. It's
Yes.
JP. It's good seeing
Yes.
everyone.
Yes.
I just need 2 minutes. I'm just rushing in from work and setting up my computer, but I'm happy that I could join you all for, I guess this is the 3rd cohort.
This is the second, the beginning of the 3rd year, but it's the 2nd cohort. JP, I thought it was you. And then I thought, why does it say John Paul and not JP? I was
No, I really appreciate that. That's right. You know, we well, the program that Dr. Mateo Garcia and I are going to be talking about, which he's a fellow in, is the Academic Medicine Writing Program. And we have our 3rd cohort this August. But I'm sorry, in 1 more minute, I'll be on with everyone. Because right now it's just a voice without a face.
Yes.
And if Christian, if you're on, maybe you want to start with your intro while I'm trying just to get this computer started.
Yeah, that sounds great. So I guess I'll just first say thank you for allowing us to be here, and especially Dr. JP Sanchez for the opportunity too. And so I kind of found out about the academic writing fellowship and the opportunity through him and his colleagues, and was able to sign up for it, and actually learned a ton of information about how to sort of go through the process of developing a project.
Oops, sorry. Let me just get out of the phone.
We have ghosts. I'm sorry. Let's see. Whenever you're ready.
There we go. Okay. Yeah. I think he'll jump on probably when he's ready. take a project, an academic writing project, so doing academic research, working with medical students and residents from the very start and the inception of an idea to completion of the project, including submission to an academic education journal. And so there we go. And so from my perspective, it's been a phenomenal opportunity to learn and grow, and then also build a team of people to kind of help along with that and kind of work with them to see a project through to completion. And so, Dr. Sanchez, whenever you're ready, I can stop talking. But in terms of time commitment and everything, it was super reasonable. In terms of time, I work a ton, probably too much more than I should, and people remind me of that, which I appreciate. But if you find yourself in that boat, I do think it was very manageable in terms of getting the project, getting the number of participants we needed, the data, and sort of building a team throughout the year is 100% reasonable and doable. And really, that speaks, I think, to the amount of support and mentorship that the program offers through people like Dr. Sanchez.
So thank you, Christian. That was very generous. So thank you for that beautiful introduction. For those I don't know yet, JP Sanchez, I used to work at the University of New Mexico and was co-PI on this grant that's led by Dr. Romero Leggett. When I was at the University of New Mexico, I had the privilege of working with Christian in the emergency department, as we're both emergency medicine practitioners, and also as serving as the Executive Associate Vice Chancellor for DI under Dr. Romero Leggett. And I think many of you are academicians or faculty. By raising your hand, if you could raise your hand if you're a faculty member, or put the reaction in the chat. I see, is the cat raising their hand? I see a cat, and I swear the cat is raising their hand.
That's right.
It's a family affair. So, you know, as all of you raise your hand who are faculty come in different groupings. There are clinical faculty who spend more time doing clinical work, clinician educators or educators who spend more time on creating curriculum, teaching, assessment, and research faculty. I would say, though, that for all faculty, whether it's at the University of New Mexico or faculty of medical schools across the country, there's an expectation to be engaged in scholarly work. And one primary example of scholarly work is publishing. Not only writing, but publishing what we do on a day-to-day basis and adding to the literature. The program that Christian has been a part of, we've actually had so far 8 faculty involved in the academic medicine writing program. And now we have 4 new ones who are going to be starting this August, is to help people think about what they do day to day and consider writing it up into a publication. And we know that publishing in a peer-reviewed journal is capital when you go up for promotion. And when you go up for promotion, not only UNM, but other institutions, it comes with a whole host of benefits, including often a higher salary. So helping people write and publish serves them. It serves the community that they're giving a voice to. It serves the institution. It has many benefits, but I'm a medical student. When I was in medical school, we weren't taught how to write. We were taught about differential diagnosis and how to come up with assessments and plans. So as mentioned by Christian, under this grant, there is a 1 to 2 year fellowship program titled the Academic Medicine Writing Fellowship Program. And specifically, you work on designing, implementing, evaluating, and writing up an educational activity for publication in a journal known as Medit Portal. So I just want to ask everyone in the room, has anyone accessed materials through Medit Portal? Have you published in Medit Portal? If anyone wants to chime in and talk about their experience with the journal known as Medit Portal. Okay, Christian, we have a bit of work to do, right? Because we want everyone to become aware of this journal and consider publishing in the journal and following in both of our footsteps. This is the journal known as Medit Portal. It is funded by the Association of American Medical Colleges, the AAMC, which is a governing body of allopathic medical schools across the country, MD granting medical schools. The AAMC has two journals. One is Academic Medicine, which is a more traditional journal. Medit Portal, the one you're seeing right now on the screen, is very unique in multiple ways. One, it's open access, which means that you can access any publication anywhere in the world for free and download the publication. You can submit articles for free, and you can download and use articles for free. Everything is free, gratis. The second thing that I want to point out is they really believe in promoting young authors. So medical students could be a primary author, residents, fellows, junior, mid-career, senior faculty, across all the health professions. So not only physicians, nursing, pharmacists, public health practitioners, behavioral health therapists. So really across the health professions, everyone should consider it. And thirdly, I think what really makes it unique is that it's about getting a product in a box. Often, many of us teach our students, or residents, or faculty, or staff, and sometimes we struggle to find the right materials, and we may be up late creating materials. If you had to give a presentation and you wanted all the materials in a box, you could come to Medit Portal. So I'm going to ask for a volunteer to talk about something they had to teach recently or will be teaching, and see if Medit Portal already has it to use to make it easier for you in implementing rather than creating something from scratch. So if anyone can put out a topic that you had to teach recently or need to teach, and let's see if it already exists in Medit Portal. What are we teaching about? Anything.
One of the comments was introduction to bedside ultrasound in the ER.
I love it. Okay. So let's look up ultrasound, right? Like any search engine, you can see what publications already exist. And by typing in the word ultrasound, there's 104 publications that you could potentially access with ultrasound in it. You could then type in bedside to see if there's any point of care. There is this one publication that comes to the top, and probably because both words are listed and also is a recent publication, Interprofessional Point of Care Ultrasound Training of Resident Physicians by Sonography Student Coaches, right? So it seems like a peer education module. There's also a module on curriculum for ultrasound enhanced physical exam rounds. Let's see, and transforming learning anatomy, basics of ultrasound lecture and abdominal ultrasound anatomy hands-on session. So let's look at this one because I think this might be a good bedside with a focus on the abdomen. To access the materials of this particular module, you would click on the download function or button, and by clicking on it, it will deposit all the teaching materials into your download folder. So I want everyone, if you can, to go to the Medit Portal website and sort of work along with me and Christian as we share with you what's in this module. Similar to other articles, all the publications in Medit Portal that exist provide an abstract in this particular abstract, and I'm just reading it out loud, the module, the teaching exercise, consists of a 1-hour introductory lecture and a 1-hour hands-on session during the abdominal anatomy course. Associated materials include the introductory lecture, presenter notes for the introductory lecture, instructor guidelines for the hands-on session setup instruction, a student handout for the hands-out session, and a module evaluation form. So the reason why I just took a moment to read this sentence is so that you get a better idea of what you're given. But if you wanted to submit to Medit Portal, you get a better idea of what's expected of you to create. And Christian is going to go over what he decided to create, implement, and evaluate in all the different components that he's working on. I'm going to take us through what you would find in this box. And hopefully this is exciting you, stimulating you to think about what you're currently teaching that you would like to submit and publish in Medit Portal. I'm going to my download bucket. Oops. Let's see, did it finish downloading? Oh, it is still downloading, unfortunately. Sorry. Okay, here we go. So this is my download folder. Here is the Medit Portal submission on instructing on the ultrasound of the abdominal area. You can see, as mentioned, there's a PowerPoint. You don't have to create the PowerPoint. They're already giving you the PowerPoint. You can modify these slides. You can add to the slides. You could remove slides. It's a beginning. Or maybe it's your total product that you're going to implement with your learners. Right? So that's the ultrasound, that the PowerPoint that they include. Let's look at what else is in the folder. They provide presenter notes. Can everyone see this slide? These slides? Is this coming up? Do you see the presenter notes? Yeah.
You see the slide, but the notes aren't opening.
They're right there. So in their attachment that they call the lecture presenter notes, they include the PowerPoint slide, and then they tell you what you should say, or what you should explain, or how to explain it, right? So it's really trying to give you, the user, the same level of success as the creator, okay? Another really important component and feature. Let's look at what else is in this box. They give the student handouts. And then they also include the hands-on instructor guidelines, right? Which is the second component beyond the PowerPoint. And let me just share that. Oops, and we're going to share this. And here is the hands-on session instructor guidelines, explaining to the instructor how to run the 2-hour session. Very detailed, right? When we create educational materials, even for a 1-hour workshop, it takes a lot of time, effort, and documentation. And if you want to help someone else be as successful as you, the creator, you also have to be very detailed. And that's what's expected of a submission to Medit Portal. That everything that you were thinking about, everything that you did in the classroom, you put on paper to explain to someone else, so that if they try to replicate your work, they have a full roadmap of what to do and how to use all your materials. So once again, the writing program is about helping you design, implement, evaluate, and submit something to Medit Portal for publication consideration. We just went through Medit Portal just to show you one example. And now I'm going to ask Christian to talk a little bit more about the product that he's working on, where he's at, and you can pose any additional questions to him as you consider applying for this program.
Awesome. Thank you, Dr. Sanchez. So I kind of gave you a little bit of an idea of ended up going through the process and the benefits of the program. And I think as you know, Dr. Sanchez was showing some of the details of that and thinking about like the true benefit of it, at least for me in a lot of ways, was not just working through the process of doing academic, you know, publications on teaching. It actually helped me, I think, in a lot of ways, become a better teacher. And so my project was specifically on discharge pathways, and not just from the emergency department, but from the hospital or any medical facility, and specifically focusing on vulnerable populations, our undomiciled individuals, people with low resource availability, whether that's because of socioeconomic status, whether that's because of the communities they live in and the distances they have to travel, and providing a better education to not just our healthcare team, our medical providers, but collectively all of the people that would be involved in those decisions. And so when we were framing this, you know, normally when I teach, I make a PowerPoint, maybe do some research, find some cool studies and do all these things. But I found myself as I went through this process being profoundly more intentional about the information. And a lot of that, again, was sort of facilitated through mentorship from Dr. Sanchez and the rest of his team about how we can really best design this, not just as an educational intervention, but so that people in other places all across the country or all across the world could take this information and employ it in their setting and not have to really do a whole lot of changes or work in that. And so it really helped me level up my game in terms of designing presentations, the intentionality behind it. And then, of course, you know, the process of surveying data, collecting that, understanding all of the pieces that go into that. I had published a decent amount of different types of research, but I really, really felt like this experience leveled up my understanding, my knowledge, and more importantly, too, a big piece of this for me was I'm going to take what I learned and build a team of residents and physical therapy students to help me with this project. And they learned along the way too. So it was kind of a win for everybody. In all of that, currently I'm finishing up. We have all of the data from the number of participants we needed. It did show a positive effect in terms of their overall understanding and learning of this idea of like, where do we send someone when we can't send them home, and what is the appropriate place for our patients when we don't have the right resources or limited resources. And so currently writing up the manuscript piece of it through the abstract, and have the instructor's guide wrapped up, have the data being essentially finalized so that we can put it into the manuscript form. And then we'll go through probably a few renditions of review and feedback from my mentors in the project, and then we'll be ready to submit it, and have created a nice pathway to carry this forward onto really all of the educational interventions that I am doing, that I didn't even know it was possible to publish, or, you know, maybe undersold the importance of creating a collective resource where people can go and reference things. And then I started using it to improve my teaching, and instead of making new presentations from you know, a blank slate, going and seeing what's out there and leveling up my teaching as well. So all that to say, that's kind of been my experience. It's a profoundly cool project and a great group to work with and learn from. And so with that too, we want to allow some time for questions. So really would just like to open it up, say thank you again for your time. Thank you, Dr. Sanchez, as well, for all of the help and mentoring through this, and for being here today. And yeah, what questions do you all have?
Thank you for this presentation, JP. Good to see you. I hope you're doing fabulous things in your new location. I took a look-see through this, and I appreciate it through the American, the AAMC. Is there something that's more broadly focused. Let's say nurses, public health nurses, pharmacists, because most of these are looking at training medical students or residents, and that's not what many of us here do. So just, I love the idea of it, but just curious if there's anything you're aware of that's more broadly professionally focused.
So the challenge is that Medit portal is so unique because one, it's free in every way. Two, it's open access to everyone. And three, although the majority of the content is through the lens of medicine, the editor-in-chief, Grace Wong, and I'm one of the associate editors, we have always worked to help authors in other health professions. So I think it's important, although it's being paid for by the AAMC, right? You don't have to pay, right? There is an opportunity to take materials that focus on common topics, whether it's ultrasound, right? It's not only for physicians, but other practitioners as well. How to teach biostats. That is something as a public health practitioner I use every day. And we know that biostats is also taught to nurses, pharmacists, physicians. So it's really thinking about, what are those sessions that are taught in your schools that not only benefits your students, but all students across HSC. And the one caveat, and you're right, Lisa, and it's great seeing you, that at least 50% of your learners must be at a medical school. So that is the tricky part. But I think that that's more with medical student learners, because all of your faculty can be at a nursing school, and that's fine. So you have to read between the lines in the criteria. Interprofessions collaboration and having all your schools so close, right? The nursing school is right next to the medical school, which is next to the public health. Everything is so close at UNM that literally you could meet your end to publish just by setting up with 1 week doing the presentation at all 4 schools, right? I think it's just the pre-planning and picking a topic that would be meaningful for all 4. So I want to acknowledge that the journal has historically been, focused on medicine, but there is the space to publish. One of the students in the nursing school, I'm blanking on his name, he worked with me, pharmacy, and students at another school to do a module on melanoma. Because he said, as a nursing student, I may have a patient who comes in with a complaint of, I'm concerned about the skin condition. And it was led by a nursing student. It was not led by a physician.
I just went into Medit portal. Exactly. I agree. I'm not a clinician, so I was curious if it had anything relevant to me. So I'll be teaching a survey design course this fall for PhD students. So I just entered survey design. It brought up quite a bit. So I'm looking at one article about training medical students to create multiple choice questions. That's probably very relevant for what I want to do. So looks like there's some good stuff in it, even for non-clinicians.
And if I can jump on one piece too, as well, is that a lot of the education that I do is not just medical students and residents. I'm the medical director of the UNM EMS Academy, and we took the format. So initially, these were the questions that I was asking myself about participating in the fellowship and learning all of that. And what I realized going through the year is this format is extrapolatable into other programs and other allied health professions groups. And so we've actually taken some of the curriculum revamping that we've done with our paramedic and our EMT curriculum and are working on using the same format to now submit that to journals that tailor to our EMS education folks as well. And so I really think that the process is really what I took the most from all of this. And although, you know, the key project, sort of the capstone project, is focused on the AAMC folks and medical students, it's extrapolatable, I think, to any learner group in the allied health professions as well.
Just one quick question before we move on to our next speakers is we have 3 community faculty scholars here and from nursing, pharmacy, and medicine. And I was just wondering if you have any suggestions for them about how this programs could be used in their worlds.
So I think that, you know, community faculty are very passionate about bringing forth the community perspective in the classroom setting, right? And this is a vehicle by which you can take what you're learning, what you're seeing, what you're hearing from your patients and your community members, and formatting it in a way that makes it easier for educators in the classroom setting to bring it in. Often deans of education or educators in the classroom setting don't want to teach something, not because it's not important, but because they don't have the knowledge or skills to do it. Community liaisons, community leaders, community workers can inform that content and work with faculty to create something that can be easier to implement in classroom settings, if that makes sense. So I think that's one opportunity.
So our community faculty mostly teach, you know, mostly teach in the community, and they are clinicians. And so is there some bridge for them in terms of, or is there an interest? I mean, I guess we could look it up and see if there's if there are any articles about community faculty educator development or something like that.
That would make a great publication. That could be a publication in itself.
Mm-hmm.
You just gave yourself a title. That could be a title of a publication.
Great. Well, I have a team here that's much better than I am at putting these things together. We'll see what happens. Thank you. So I want to thank you both, JP and Christian, for joining us today and for meeting our second cohort of faculty scholars, academic and community faculty scholars. And I hope to see you again, JP, and Christian, I hope to bump into you sometime in the campus. And let me introduce our 2 final speakers. Thanks again. And we really all wish you, I hope you're really happy where you are. Are you happy where you are? Yes. Yes.
I am, but you know, I miss all of you, and thank you for allowing me to be a part of it today. Take care, everyone.
I was just thrilled to see you, and it was like, huh, who is this guy? And then it was just great. I thought, I know this guy, you know, but it's not JP. Anyway, thank you so much, both of you, and look forward to seeing you both again. And I'm going to use my next minutes to introduce Kenneth Ward and Roberta Lavin, who are going to talk about promotion issues for nursing and pharmacy. No, not nursing and pharmacy, nursing and public health, right? Is that right? Yes.
That's
Good.
right.
Good, yes. Thanks. So you take it away.
Would you like me to go first? Okay. Hey, everyone. I'm Ken Ward. I've been lurking since the meeting began because I'm fairly new to UNM, and I want to know more about the Faculty Scholars Program. So it was very informative. So I'm glad I was able to do that. So I joined UNM this past September. I'm a professor in the College of Population Health, and I serve as Assistant Dean for Faculty Affairs. So I was asked to talk a little bit about our promotion processes. So I'll do that. Let me see if I can share my screen. So one. Okay, can you see my slide?
Yes.
Okay. All right. So first, let me just give you a little bit of background. So College of Population Health is the newest college or school on campus. It actually began 30 years ago as a MPH program, Master of Public Health in the School of Medicine, in the Family Medicine Department, and it became an independent college in 2016. And our goal is to become an accredited school of public health within 5 years, or about 4 years at this point. So to that end, we have grown exponentially. So at this point, we have 40 full-time faculty members. 24 of them were hired just within the last year, and 16 of those are pre-tenure. So you can see that setting up good promotion policies and policies and procedures is very important, and it's what I've been spending a lot of my time doing over this last year. So faculty have spent the last couple of years developing faculty bylaws, and I'm not going to belabor this, but I just want to point out that all of our policies and procedures related to faculty success, tenure, promotion, appointment, dismissal, come from our faculty bylaws. So faculty have had considerable input in that. So our evaluation procedure is fairly typical for what other units at UNM do. So as the point person for faculty affairs, I work closely with all of our faculty to prepare them for evaluation, and I work with the P&T chair to ensure that the process goes smoothly. We do our mid-probationary review at the start of the 4th year. I work with folks in the 3rd year to get ready for that. And then P&T review is done during the fall of the 6th year. We're small and we only have 2 tracks. So we have a scholarship research track and an education teaching track. We have one P&T committee who handles both of those. The committee is appointed by the dean annually, consists of several senior faculty members chosen from the different units and concentration to make sure we have good representation. Professors evaluate all cases, and associate professors evaluate cases up to the level of associate. So the overall goal for our promotion processes is to ensure that candidates will get ongoing actionable feedback to ensure successful promotion. So that's done all throughout their tenure in the department through annual evaluations, hopefully through good feedback from their mentorship team and from the mid-probationary review. So I've been working hard to develop a, so to speak, a best practice mentoring and professional development program. So the way that we've done it over the past several years is that all new faculty, when they come in, get assigned one research mentor typically and one teaching mentor, and that's done by the dean and the leadership team. And we're working now to expand that. Again, sort of using best practices that we don't want people to be mentored just by a single individual or two, but to have a developmental network, to have several people. So we're starting off with having mentors receive training. So we're taking advantage of the Faculty Echo program, specifically the Faculty Mentoring Faculty program. And we're working to standardize expectations for mentors and mentees because it's been very informal, as I think it is in a lot of departments across campus. But we often mentorship can get lost in the shuffle because people are busy. Mentees often are reluctant to set demands on mentors. So we're setting expectations for the relationship. And it's important too that mentors are incentivized for the work that they do. So we've worked to make sure that mentoring contributions are recognized as part of our promotion process to full professor and also in the annual review. And we've developed a evaluation system to make sure that from the perspectives of both the mentees and the mentors that it's been effective, and also to look at objective outcomes from the relationship. And we've developed several different internal trainings to help ensure promotion success. So those include P&T preparation workshops. Next month, I'm going to be starting a dossier writing accountability group. So all of our faculty who'll be going up in the next 2 years were invited to participate. All of them were interested in doing this just to give them some guidance on writing the dossier narratives and to have some set aside time to work on that and to get feedback from others who have gone through it. We also have a more general writing accountability group to encourage people to set aside time to do academic writing. We're offering several brown bags. I've just canvassed, faculty about different topics that are high priority, and we'll roll that out this coming year. And we're also, looking to improve our peer teaching effectiveness assessment. It's been very informal, so we're formalizing that a bit more so that all early career faculty get some consultation to help them improve their classroom teaching. And we're lucky that there are a lot of resources available on campus. So I'm trying not to reinvent the wheel and encouraging people to use what's already out there. So the advanced group on main campus has several really helpful workshops, and it applies mostly to departments on main campus, but they're useful too for health sciences. I've sat in a few of them, and they're related mostly to promotion and tenure related topics. But, we have resources through the Office of Continuous Professional Development, through our institutional membership with the National Center for Faculty Diversity and Development, the Center for Teaching and Learning. They provide some excellent resources to help faculty improve their teaching. So we're encouraging faculty to take advantage of that. So basically, we're trying to make sure that faculty feel supported, feel that this is a good place to have a long career, and are getting the support that they need to be successful at promotion time. So this is new and it's ongoing, and it'll be iterative. We'll change this and adapt it as we go. But that's a general overview of what we're trying to do. I will stop there. Are there any questions that I can answer?
Any questions? We have a public health faculty member here, but if,
Yeah, Verlin will be
Mhm.
exposed to a lot of this coming
Right.
year.
Anyway, so you're the go-to person if something for Berlin or others.
Right.
Yeah, thanks. Thank you so much.
Sure.
Thank you. And next I'm going to introduce Roberta Lavin, who has the undeniable privilege of being the last speaker at the end of the day. Way to go. And thank you so much. I wanted you all to know that next week we'll have another orientation series that will start also at 3. We're going to start with Steve McLaughlin, who's the head of he's the chief medical officer of UNM Hospital, Gary Smith from CPL, and Dr. Sood himself. So I want to thank you all for joining us, and that we will have in the following week a conversation about promotion for medicine and pharmacy. So thanks very much, and take it away. Take it away.
Hello, everyone. I thought I'd also share a few slides with you, but mine are a little more directed toward our clinical faculty in nursing, since that's what Dr. Sood asked me to speak to. So all of our stuff is actually in our College of Nursing policies and in our faculty handbook. And we have 3 tracks. We have a tenure track, we have a clinical educator track, and we have a lecturer track. And each group has its own promotion criteria. The most cumbersome are probably the tenure track, for obvious reasons. You're kind of giving them lifetime guaranteed employment. And that is only slightly more difficult than the clinical educator track, and which is also a cumbersome process to do. Once a clinical educator has been in rank 5 years, they're eligible for promotion, to compete for promotion. Now, 5 years means that at 4 years, you can ask to apply. And usually they talk to their assistant dean and say, do you think I'm ready? And have I done everything I'm supposed to do? So to me, the easy way to figure that out is to look at the criteria for the next rank up. And if you look at the basic criteria for the next rank up, they tell you what you should do in teaching, scholarship, and service. And I always try to tell everybody we use Watermark to track a bunch of the stuff we do on a regular basis. But it's always good to keep your own separate CV for the day when the system, gets hacked and somebody decides they want the university to give them $10 billion to get all the information back. Yeah, you want your stuff backed up somewhere else. And you want to write it down as you do it, because you will forget it. You will think, I'm going to remember everything I did this year. Nobody remembers everything they did at academia, because if you're productive at all, you're doing a whole lot of things. So basically, people need to look in their faculty handbook, which is where this document is housed, and see how they're doing in meeting these requirements. But they also need to be laying them out on their CV and in their Watermark record, so that you're showing that you're doing more, that you're progressing, ideally that you're exceeding all the standards that were met, that were set for you. And this is similar in the lecture track, except for not quite as much emphasis on scholarship, and not quite as much emphasis on service, because their teaching load is so heavy. So they tend to be teaching 4 courses a semester, which is a lot of teaching. For us, one of the things that you have to keep in mind is the timeline. Like Dr. Ward said, you need time to do this. It is a time-consuming process. And one of the things you're going to need, if you're in the clinical ranks or the tenure rank, is external letters. So you've got to think about the criteria for these external letters. Usually a minimum is 3, but it ranges from 3 to 5 depending on, well, what the committee wants and what the college wants. These letters require your dossier to be put together, and then we share it with the people that do the external letters. And they usually get at least a couple of months to look at the stuff. These have to be people that are in your area of expertise at another university, at or above the rank at which you're applying. And by the way, you really shouldn't have worked with them before, and you shouldn't have probably published or done research with them. So the older you get, the harder it is to think of the people that you don't know and haven't done something with from all the conferences and things you go to. But you always want to keep, when you go to conferences, a list of people that could potentially be reviewers for you someday. So I wanted to share this because this is the timeline, and you should probably start at the end and work backwards, because the end is the date at which Ziodonis makes his decision, and everything flows backwards from that. And what you notice is, even though we start this process in August for a final promotion decision, that probably isn't going to happen until May of the following year. So that's a long time. And once we turn the system on, which is in Watermark, a lot of your information is already there. And ideally, the supervisor and whoever is the chair of the committee is going to review this, and they're going to give you a quick assessment of whether you're ready, and if you're not, what else you would need to add to this. And then you have to have a supervisory letter, has to be put in. The promotion, and we call it P&T, promotion and tenure, but it's not obviously tenure for the clinical people, but that committee meets, and that committee is made of people at or above the rank at which you're applying. For our clinical educators, that's made up of clinical educators and tenure track faculty, and probably I guess people from other departments, because we don't have enough clinical educators at higher ranks to meet our requirements. For lecturers, it is a committee that's made up of everyone. Again, they have to be at or above the rank that they're applying to. Once the committee makes its recommendations, it goes to the dean. The dean makes a recommendation to the vice chancellor. Human Resources notifies the office of the chancellor, and then this all goes forward to Zia Donis for an approval. If you're an instructor or you're just a mid-probationary review, it's somewhat streamlined. The process is about the same. We open it at the same time. You don't have to have the external letters, and that saves a whole lot of time for everyone. So I would, let me stop sharing so I can just talk to you. One of the things about the promotion process is it's really just important to start thinking about it from day one and to start building your portfolio so that you meet the requirements for promotion. And there's always that person that says, oh, I'm fine being an assistant professor, or I'm fine being a lecturer. And 5 years down the road, you think, no, I'm not. I want to take that next step in my career. So you want to plan for the next step, even if you think you'll never take it. And part of that is some of the stuff you heard about earlier about publications, which matter in any track you chose. So if you can publish with people and do research with people, that is certainly going to help you be promoted. But so is the service component. And that requires that you start out being on committees. You eventually take leadership role in that committee. If you can chair committees, that's great. And then you want to take a leadership role in university committees. And you want a balance of all these things. To me, there's only one way to find balance in everything you do. You find your area of scholarship, and you make sure your teaching, your scholarship, and your service all align. Otherwise, you don't have time to do it all. So if you're in the College of Nursing and you want more information on this, feel free to just call me, or in about a month, you can walk over and walk into my office because we'll all be in the same building. So thank you. Helen, you're on mute.
Thank you. I think it's to both of you for very clear presentations in a sometimes somewhat murky area. What I would like to also ask you about, right now this year, Kenneth, we don't have a community faculty scholar in the public health realm, but we do have, but you know, Verlin. But for Roberta, we have a community faculty scholar, Rebecca French, who is a nurse practitioner in Aztec, and we would like to know if there's anything special for her to think about as she thinks about the potential of being promoted as a community faculty member. Does that exist in the School of Nursing? The college?
So it depends on how they brought her in and if they gave her a rank. So she may be able to answer this, but if she is like a clinical assistant professor, if that's the title, what did they give you?
I'm really just like adjunct faculty right now for I do precepting UNM students clinic.
So generally the only way you then do that is get them to write it into your contract. So they give, in nursing, we give annual contracts. You just start saying, I want you to consider adding a title into this contract of, if you're a doctorally prepared clinical assistant professor, and you can get that written in there, in which case you should be able to then eventually get them to elevate that. But it's a contractual issue as long as you are considered adjunct faculty. But it's worth one having the conversation with Gina Rowe about, and say, because seriously, it's just words on a piece of paper. It doesn't cost them anything to use the title, and they should probably be able to do that. And certainly it would be important if you decided that you got tired of seeing, as we get older and our desire to see patients 12 hours a day and then write notes starts diminishing. It's really helpful if you have an assigned rank, because then you can say, I'd like to come on faculty full-time, and you use that for the negotiation of your contract to come on.
Thank you very much. That's very helpful. Any questions from our team here? Any other comments from our the COE team as well?
I'll just say, as somebody who's going up for promotion in 2026, I found it helpful to get packets from certain colleagues who've just been promoted. So I have a colleague who was promoted this year, a colleague who was promoted 2 years ago, and I think 3 years ago. And so I'm just kind of comparing and contrasting what their practical dossier looks like to get a sense of what I could be documenting or should be documenting as I go.
I think that's very helpful. I've been collecting packets from people who went up recently with their permission, sharing it with people who'll be going up.
Yeah, that's what we did also, because when you read the words, it doesn't mean anything, until it seems so overwhelming. Like, how do we do this? And then, but once you see what the packet looks like and how someone responded to the requirements, it makes it much easier to even think about going through the process. So,
yeah, and I would also say, have somebody that's been through it recently review your packet. And ask the people in leadership to take some of them, especially like Gina or Mindy or even me in faculty affairs, to take a look at it, because we'll look at it and say, oh, you're missing this, or oh, you're missing that. And that can really be very helpful and save you a lot of heartache. It's an intense process. So
it is. Well, thank you everyone again for joining us today, and for the really helpful conversations we've had so far today for our faculty scholars. And Wendy, what is this that you're sending us?
I just threw in the chat, the faculty mentor development program starts August 8th, and there is the enrollment link if somebody wants to get ahead. We'll send it out the week before, I believe, but if you want to poke around in it before, there's the link. You
Great.
can always contact Samurai if you have any questions. Not necessary, but if you want to.
Well, thank you. That's great.
Yes, and
Amy?
we had a really wonderful suggestion in the chat earlier in our meeting, that in order to help, build community amongst your cohort, would you all be open to sharing each other's contact info? So I was able to accomplish that behind the scenes. So I've dropped the directory in the chat for you all, so that you have each other's email addresses. You could be in touch with each other, as a community going forward. So I think that was a really nice idea. Thank you for suggesting it, Lisa. Yeah, hope that's helpful to everyone.
Thank you so much, Amy. And thanks again to everyone. Let's all have a great evening, and I look forward to seeing you all next Wednesday. Take care. Bye-bye. Bye-bye.